Good morning and welcome to the Aggie Hour. I'm Crimson Jeffers. I'm the PR and Communications Specialist for Sylacauga City Schools. And this month is CTE month. So this morning I brought with me Miss Brittany Carr and Miss April Lane. They are our health science extraordinaires at the high school. So could you walk me through a little bit about health science and kind of what y'all do in your pathway? Because I know it's very specific. Y'all do a lot of different things.
So specifically for our pathway, we hope to prepare the students for careers in healthcare, whether that be nursing, respiratory therapy, physical therapy, anything like that. So we have a couple of courses that we teach on campus. We start with the foundational level course that everyone is required to take. From there, they are able to go and take some additional courses, either through dual enrollment or through us. Us specifically, we have some that teach them patient care tech skills that leads to internships throughout the community.
And I know that we are very lucky to have Coosa Valley. We have some students that are actually interning there right now. We've got 5 this semester, right?
Right. We just did our orientation yesterday. Jeff Wood walked us through it. He took us through a tour of the hospital. Everyone at Coosa Valley is fantastic. And I actually was talking to my students and told them, you guys are really lucky to have this in your hometown.
Absolutely. And we also, we start health science at the middle school because we've got Miss Mitchell over there kind of getting them ready for that foundational course as well, getting them ready to come into foundations with you all at the high school. And then there's also, CTSOs, our student organization is HOSA. So could you walk me through a little bit about what HOSA is and what it does for our students?
Sure, I'll be glad to. HOSA is our healthcare occupational student. We used to be association, but now we're all across the country and we're all across the nation. So it is now an international CTSO. And so what we do is we just integrate it into our curriculum. And we have competition, the kids get to practice, they get to compete, they get to meet other people from all over with state, and then after state we go to nationals. But it's basically just, it's hands-on. It teaches the kids, like, we take the school, the book work, and then we put our hands to it, and we get into the different categories that they can compete in.
And what are some of those categories that they can compete in?
There's several. Let's see. Extemporaneous healthcare poster. The kids love to do that in the middle school level because they can do that in 7th and 8th grade. We have physical therapy. We have, you'll have to help me out here. Public speaking. Yes, we have forensic science. We have veterinarian. We have medical reading. We have medical spelling, medical terminology. There's probably about 40 different categories that the kids can compete in.
And you don't think about public speaking being a part of healthcare, but then you have to think about that patient advocacy. You have to think about like talking to the families. It starts to make sense when you're like, public speaking doesn't belong in healthcare, but then you start thinking, yes, it does.
Yes, it does.
So is there anything else like super exciting that's happening in your classrooms? I know that y'all are very hands-on. You've got your hospital beds and your patients lined up in there. What's happening in y'all's rooms?
So we just received a Blue Cross Blue Shield grant, so that was really great. So we have purchased a new hospital bed. We're waiting on that to come. And just getting in there and getting hands-on. My patient care techs are just eager to really get into it and get hands-on, so we're loving that. My interns are actually going to Indian Valley this Friday. They're going to be doing some hearing and vision screens. So just getting them out, getting them working.
And that's so important too, because those hearing and vision screenings, especially for our littles, if we catch it early enough, it's a lot easier to be reactive because you can go ahead and get those things taken care of early instead of waiting until they become a bigger problem when they get older.
Correct. And we're thankful that they are allowing our students to do that. So that's great.
Absolutely. Like, I'm super excited because I know that the littles are always so excited to see the big kids too. Like, so
especially in their scrubs. They
love
that.
They love the scrubs. They're like, oh look, a doctor,
or a
nurse, whatever they already know
about them.
And that's so great. I know they recently had Madeline Friday come by and talk to them. Like, she's in her first year of med school at UAB.
Okay.
And she was talking to the kids. She's like, who wants to be a doctor? And they all just started raising their hands.
Oh, that's great.
It was so great.
Yeah.
We need more. We need people in healthcare, we need the nurses, we need the doctors, we need the techs, we need them all. They're all very essential to our workforce, not just in Sylacauga with Coosa Valley, but just our state, our nation. We need them everywhere for sure.
Yeah, we do. That's true.
So is there anything else that y'all want to add? With it being CTE month, anything else big that y'all have planned in the health science world?
I know that we have a blood drive coming up in the spring.
Okay.
We had one in the fall, and it was very successful. Do you remember how many donors we had?
We had about 62.
It's
So
like
around
60.
It was
60
like
something.
62 to 71, something
Something
like
like
that,
that.
I remember.
Yes, so that every time you've got one donor, you can save potentially 3 lives, and so it's very important. We have that coming up in the spring, so everybody keep an eye out.
Perfect. Well, thank you guys so much for coming this morning and
Thank you
joining
for
me
having us.
talking
I appreciate it.
about health science.
Thank you so
All right.
much.
Thank you guys. Have a good day. Go Aggies.